Professor Clara Ejembi, a life of service, family and legacy. In every generation, a few remarkable people rise not in search of praise or fame, but because they were born to serve. Professor Clara Ejembi is one of those rare souls. Her story is a journey of strength, compassion, and an unbroken commitment to humanity. Born into a home built on discipline, empathy, and community values, Clara showed her promise early. Quiet, determined, curious, and warm, she grew up helping others with a natural sense of responsibility. From childhood, she was already a leader, soft-spoken, yet driven by purpose.
My name is Murna Sakaba. I'm the elder sister to Professor Clara Ejembi. I'm the third born of the family. Clara is the fifth born of the family. I was there when she was born. I was there when she was growing up. And I've been there throughout her life. I know her for the past 70 years, or the 70 years of her life. Clara has been the most intelligent and the most brilliant member of the family. Her position has always been first, throughout primary school and throughout secondary school.
First instance, for some people, when meeting Clara, or my elder sister, whom I fondly call Ilori, Clara Ejembi, Auntie Clarus. Some people might think she's a very arrogant person, a bit difficult, but when you get to know her, she's one of the most simplest human beings you can ever meet and relate with. And it may shock some people, she's a very, very humorous person, yes. Because of the age gap, by the time I grew up, the only time we normally meet in the village at home was during vacation. By the time I was either from 2 or 3, she was already in the university. She was a big girl because of the age difference, you know. But then whenever we meet at home for holidays, for the short period, maybe a month, maximum 2 months, it was always very lively, very memorable.
At just 17 years old, she gained admission into Ahmadu Bello University, Zaria, beginning a journey that will shape public health practice in Nigeria and beyond. Through decades of her hard work, she rose to become a respected scholar and mentor. Today, in December 2025, she celebrates her 70th birthday and retirement as a professor of public health from ABU Zaria, closing a remarkable chapter with grace and gratitude. Even at the height of her career, family remained her anchor. As a mother, she led with love and strength.
Growing up with my mom, as we fondly call her Likita, was quite interesting. She has always been a workaholic. So we grew up in and out of clinics, sometimes the hospital. You know, she was almost always busy on one trip or the other. So it made interesting times. I traveled a lot with her. We always used to travel for holidays and stuff like that. So growing up was quite eventful. One of the things I would say that my mother has is tenacity. You know, she has a can-do spirit. She's always almost always busy. You know, she doesn't give up on her work. She doesn't give up on people. So I would say, in terms of, particularly in her work ethic, you know, I think that is one of the things that I have emulated, because I don't know how to not work. And you know, so she's always working, even though I still think she does not. Well, I think, yeah, one of the things that I have picked up from her is her tenacity and her work ethic.
My name is Michael Musa. Professor Clara is my mother-in-law. or Likita as I call her. She's been both mommy and daddy to my wife, Miriam. And we've had a very, very good relationship so far. And should I say she's made marriage very, very easy for me. One thing I've learned about her is to always hold on to God, be very spiritual. Because with that, you don't really need anybody. You don't need to lean on any human. In as much as you need relationships with people, but your ultimate help comes from God. And that's one thing I've actually learned from her. I've also learned resilience from her because she reflects it in everything that she does. She pushes very hard to achieve things that she wants to, and she works her socks off whenever there's a task at hand.
She's my grandmother. She comes, she always brings food. I enjoy resting with her.
I've known her all my life. I've been privileged to be raised by an army of very strong power women, one of which is my Auntie Clara. I would describe her as a unique spirit. She's very kind and generous-hearted, very witty. She has a great sense of humor, and she's an excellent cook, especially if you like pepper. So growing up, I have a lot of fond memories of my auntie, and we always had a lot of fun coming to Area A for holidays, spend time with my cousins, and there was always a lot to do. We'd play tennis, we learned to play chess, we would climb trees, ride our bikes, go swimming, go for Pan Am Pasipal concerts. So there was always an atmosphere of joy and laughter around her.
Abin da dai ina da godiya sosai, kuma ina mata addu'a ita ma kamar yadda take taimaka mana, ubangiji Allah ya taimake ta, ita ma Allah ya bata sa'a kan duk abin da take nema. Kwarai da gaske wannan mun gode.
Beyond her family, she became a pillar to many. Professor Ejembi was not just a lecturer, she was a guide, a protector, and a builder of futures. She mentored hundreds, asking about their fears, their hopes, their purpose. She pushed them to think, to lead, and to serve humanity. Her classroom extended into communities, hospitals, rural villages, and global spaces. To her, knowledge only mattered when it changed lives.
Professor Clara Ejembi is the foundation president of M1 Kaduna. By that, I mean she was the first president to lead our association. I am the 10th, but she is the first. And through her insights, her experience, her support, her guidance, we have been able to bring together a very good BGM. For us, she is our mommy, she's our star, she's our pillar, she's our super supporter, and we are all here because she has shown us guidance, direction, and she has been a form of advisory to Medical Women's Association of Nigeria.
I served under her as the zonal coordinator, planning coordinator, and we worked assiduously for several states, one of which is Kaduna, and then we were also drafted to work on various other plans across the country. And I think the plan that we did became a prototype for the country that was adopted by all states in the country. For me, that stood out very significantly as part of the key work that she has done for the country.
Professor Clara Ejembi is so many things to me and my siblings, because she, first and foremost, she's a mother. We come from the same place, that's Kagoro. We are all indigenous of Kagoro, and she knew me since when I was a child. So she was first a mother. But as a medical student, she was my teacher in community medicine, and as a consultant public health physician, she was my trainer at the National Postgraduate College of Medicine for Nigeria. And lastly, she's a mentor, my mentor extraordinaire. I'm one of her so many mentees that look up to her for drive, for direction, for guidance, and she has been She has been wonderful. Professor Clara is so many things to so many people. But for me, she's someone very dear and special to me because she has been with us, I and my siblings, when we needed her the most, and we will never forget her. So she's someone that is loyal, and she's reliable and constant in our lives. And I look forward to other younger ones actually learning a lot from her, because when you have someone that is dependable and reliable in your life, you have the right shoulders to lean on, you can achieve anything. And part of my success is attributed to her for being there and encouraging us and being in our lives all through.
So I first met Prof. Ejembi probably in 2009. I was working for the same organization I work for now. At that time we were at Venture Strategies, and now we're now doing business as Oasis. And I was taking over a project for my colleague on operations research that Professor Ejembi was leading for PRHI at ABU. And they were doing it in collaboration with the Bigsby Center at UC California, Berkeley, and our organization. And so I was the program manager that was working on that research with Prof. Ejembi, and I got to go out to the field a lot. We were working in 5 communities in Zaria, and she was magnetic as a personality, and it was really fun watching how when she went into communities, the corps, which are the community resource persons, and the TBAs, the traditional birth attendants, and all the different students in the area were just really excited and enthusiastic about the project and work. And one thing that I deeply remember about working with her and being in that project, coming to Nigeria, it's a really warm country, but she often really treated me like family, and it was just a really exciting time to feel so welcome and so accepted in a community that wasn't naturally my home. So I had a really wonderful working experience with her.
And Dr. Clara Ejembi was my teacher in 1985 in community medicine. She was a young lecturer just starting her academic career then. And I remember her as someone who was present, who cared about her students, who was diligent in preparation of her classes, and ensured that, in fact, her students understood what she was trying to convey in the practice and in the theories that were driving the approach of community medicine at that time. Ejembi was very strict disciplinarian. She gave not only the theoretical perspective, but also the application of the theory in practice. I think she cared about her students, their learning, their understanding, as was present to answer them.
Yeah, you see, Clara Ejembi, her name is a household name. It's an icon that worth emulating. I can remember vividly when we were students, she is one of the persons that actually inspired me to go into public health. And I must appreciate, and I deeply appreciate what she has done to us, because there was this kind of practical demonstration of what public health is all about. Then there was no technology. She would take us, we'll go to the villages. She would be with us all through, you understand, showing us step by step from the beginning to the end of community assessment. And thereafter we come out with something that we're going to present as a case, and we deliberate on it, and we come out with a result, and that gives us an informed decision and the policy, ingredient for the policy formulation for that community. So, be as it may, she has tremendously contributed toward public health development in the country. Most of us who actually went to Zaria and then northern Nigeria, we see her as an icon of public health or community medicine. Then that's what we used to call them. And so I must once again congratulate her for reaching this age alive, and she's still active. And we thank her for investing in us.
I can't tell my stories today of my success because I always say I am blessed. I have had a very good journey in public health. I can't talk about my story and my journey in public health without mentioning Professor Clara Ejembi, because she is someone that I came into contact with her when I started my residency training. She was the head of department. So she gave me opportunity to join. At the time, they have almost closed the entry, but she still gave me opportunity. So she taught me, she mentored me. She made me, have a better understanding of myself, to have confidence in myself, because the way she teaches and engages with me. She made me to break barriers, to go beyond the limits where I thought I cannot go, and made me to do things, with due diligence, with confidence that I can do it. So those were my relationship with her. So it's just beyond even knowledge. It's even about making me to feel that I can do it, as long as people can do it. And I'm glad that I have passed through her, because being the first resident she trained, she did not just train me and presented me for the National Postgraduate Medical College, but I came out as the best of her product. Not her product alone, but the best overall product of that college in 1997. And the best dissertation that was ever supervised from that college. But it did not go through a lot of difficulties. That time I was still thinking that I was going through a lot of difficulties with her. I didn't know it was really shaping me for better. So that was why I said I can't tell my stories of success without talking about Clara Ejembi. So when I started working, of course, she's someone that I felt I should confide in, because she continued to guide me. We remained connected together. So that was why I say it's beyond teaching, it's beyond knowledge. But even in my work career, she continued to mentor me.
I was hearing stories about one very tough woman that is in the department. She's no nonsense, and she was the only woman, in the whole department until I came, and there were two of us. And I was like, okay, so when I see this person, how am I going to react? And even the men are afraid, of her. So what will be my fate? Then she came back, and the first time I saw her, I was not really very comfortable. I was like scared to even go close to her, and things like that. But after a while, I came to realize that she's really a teacher by heart. She has this, she's a very good listener, and she has this, should I say, calm seriousness, about her. She has patience. When you do something and she wants to correct you, she corrects you in such a way that it's even inspiring, that the next time you will not even repeat that kind of thing. The contributions, not only in Kaduna, but in Nigeria as a whole. Ejembi, as I said, is a teacher by heart. For every opportunity she gets, she tries to, impact knowledge. She's been in service delivery. She's been in research. She's been in quality improvement. So she's like everywhere. She's mentored, I think she has like primary healthcare at the core of her heart. And there's nothing that I think Dr. Ejembi wants to see as a primary healthcare system that is well grounded. So she has been taking her time to ensure that people that come across her, are actually well grounded, so to say, in primary healthcare. Whether you're a nurse, a community health officer, a doctor, all of us have that thing that Professor Ejembi is really thorough.
Professor Ejembi's life has been a symphony of service, scholarship, leadership, and unwavering compassion. She has been my teacher, my mentor, my advisor, and in many ways, one of the guiding lights of my professional journey. Reaching 70 years is not merely a milestone of age, but a testament to a life lived with purpose, consistency, and deep commitment to the betterment of others. When I think of Professor Ejembi, I think of someone whose every year has been spent building people, strengthening institutions, and uplifting communities. I first met her within the walls of the university during those formative years when one's vision was still fragile and one's dreams are still unshaped. She carried a rare ability to guide without imposing, to challenge without discouraging, and to nurture without ever making her students dependent. She taught me that excellence is not an act, but a habit, that public health is not just a career, but a call to serve humanity.
It is so simple that at a point, I didn't know, when I first knew her, I didn't know the caliber of person she is until when somebody told me, I said, well, she just looks simple, you won't know the way she relates with people. And I've come to discover that she has a heart of caring, has a caring heart to help humanity. From time to time, you see her looking out for a way or for any area she can assist in the church. Is it contribution to missions? We have, at least she has made a huge impact in the mission ministry of the chapel. And also, we talk about the needies in the church, the widows, the orphans, and the widowers. She has been one of the figures that has helped in providing for the needs of these people.
By the grace of God, I've known Clara Ejembi right from my student days. At some point in time, I wasn't actually close to her, but after the death of her son, we became very close and intimate. And over the years, I have the opportunity of working very closely with her. And I can say one thing about her, she's a very, very concerned and sacrificial person. There is no how something will come her way and she will not make a contribution to that. So over the years, I can really tell she has made significant impact in this assembly. And as we look forward to her 70th birthday, I can say that great things are about to happen.
I met Mommy in Chapel of Redemption here. Honestly speaking, I cannot really say this is what I got to know Mommy, but somehow, our spirit just, like say, jam or whatever, connected. She took likeness in me and I automatically became her daughter, you know, and ever since, she has been so good. She's somebody I can run to. She's a mother indeed. You know, she has the art of giving and she's friendly, honestly speaking. And one or two people have even asked me, how do you even connect with this Mommy? I said, I don't know, I cannot even say. It's just God that connected us, honestly. And ever since I knew Mommy, I've been, how will I put it? She's somebody to emulate, she's somebody to be close to. Okay. And I've never regretted it.
Her journey was not without sacrifice. Behind her success were countless late nights, difficult decisions, and years of service to people who needed a voice. Her work strengthened health systems, shaped public health policy, and raised a generation of compassionate leaders who continue her mission today. Her colleagues admire her integrity, her friends praise her kindness, and her family cherishes her
Christian
wisdom
family, so
and
let's start from there. My father was a reverend. My mother was teaching in the Bible school. And Kagoro, as far as I'm concerned, that time I think there was only one Muslim family. So it was a Christian community. And morning devotion was by force, by fire. Whether you want it or not, you don't wake up in the morning at 5:30. My mother will come and pour cold water on you. So we saw it as it was something that was forced on us, actually, and we must do it. But I think by the time, so the moment we left Kagoro and went to secondary, I thought it was freedom. Nobody is forcing you to wake up at 5:30 and do all those kind of things and all those kind of things. But along the line, I think it was in my Form 3 or 2, thereabout, somebody came for a crusade, Rio in Kagoro, and it was then, during the preaching, it dawned on me, we needed to accept Jesus, change our lives, and look at it as a way of life, nothing that is forced on you. I came to university again, there's a lot of freedom, permissiveness, and so actually, when I became a bit more serious with my Christianity, was after the loss of my husband. But when my husband was alive, he was like a god to me. Everything of my life was dependent, heavy, and he was larger than life, and did everything, sorted out everything, knew everything, organized everything, so he just relied on him. And God in his wisdom decided to call him home. The battles I have fought in this place, it would have been a different story. So my faith has shaped my absolute dependence on God. My faith has taught me, that the battles are not physical, they are spiritual. So my weapon of warfare has not been physical, it has been spiritual. And I have survived because of that complete dependence on God to take absolute control of all situations in my life. My faith has also given me inner peace. I've had peace in spite of turbulences. I've had peace. And of course, the grace of God has been sufficient for me. God has been faithful. He has kept me. Things that could have pulled people down, I'm still standing. I'm still bouncing. I'm still moving. It's all the grace of God. In terms of legacy, my legacy would be actually in the area of service, reaching out to people, especially people in need, the vulnerable populations. I've strove to do all of that. In fact, in Zaria, there's under the Ministry of Excellence, there's a Ministry of Grace that we reach out to widows and the needy. It's coordinated by Professor Dashi, I co-coordinate. So every year we do, apart from the monthly meetings, every year for almost 10 years now. So either buy wrappers, go to Kano, buy wrappers for all of them, give them money and all of that. So I do that in Kagoro, the widows in Kagoro, every Christmas till a few years back. We buy wrappers or grains or whatever, send to them, they share. In the church, we do the same. So at least reaching out to people in need is one thing. And of course, the legacy of doing projects is not about getting grants. Use it in a way that impacts the lives of people is what people should be striving at. And thirdly, it's not about the number of papers you write, but to what extent are these papers impacting on policy and practice.
Now, as she stands surrounded by family, colleagues, mentees, and friends, celebrating both a birthday and a retirement, we look at a woman whose legacy is written not in titles but in people. Her influence lives on in her family who carry her values, in her students and mentees spread across the world, and in communities transformed by her compassion and knowledge. Professor Clara Ejembi teaches us that true greatness is simple: love deeply, serve humbly, teach generously, and leave the world better than you found it. Professor Clara Ejembi, a mother, a mentor, and a guiding light to all.